Hello, everyone, and Happy New Year 2024. I would like to welcome you back to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual neurolinguistic programming and cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, do life coaching, business coaching, retirement coaching support, and also provide individual one-on-one session in both French or English, and also do group settings. If you need any assistance, reach out to DMB Therapy and Coaching Services at 301-325-1550, and our website can be found at lifecoachdanamzalai.com. Today, I'm very excited to have for our 8th episode of season 19, a very special guest and pain management expert, John Fitzgordon. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. John, the floor is yours.
Thanks so much, Dan. Thanks for having me on your show. I really appreciate it. So I am a pain management specialist, and I was my first client, and that is where my story begins. In my early 30s, I started doing yoga, and I had done it when I was a very little kid. With my mother forced me to do it, and I didn't really love it at the time. But when I got to yoga in my 30s, I felt like I was home. And I got into it very quickly, started doing it 6 days a week. Got pretty advanced pretty quickly. And it turns out I was advanced because I'm hypermobile in my joints. My joints are very loose. So I was able to do very cool yoga tricks, put behind my head and all sorts of things like that. And everything went great for like 2 years before my knees started to hurt. And the place I was taking yoga, they didn't teach you how to do it. They just said, do it, and do it as deeply as you could. So in the long run, I ended up really hurting my knees, and I had 3 knee surgeries. And following so every surgery, doctor, physical therapy, surgery, physical therapy, back to the doctor with another injury. After the 3rd surgery, same thing. And I was back on the yoga mat, ready to start again. And one of my teachers asked me, so what are you doing to prevent a 4th surgery? And that was it. That was my wake-up call. I realized nothing. I am going to be back here again. I didn't really understand what hypermobility was at the time. I started studying posture and walking. I would say I didn't even understand hypermobility until I was teaching walking for a couple of years and started to realize that all of my clients were similar to me. All of my clients fit into 2 categories, usually either highly sensitive people who don't react well to surgeries, medicines, injections, or hypermobile people who very often don't even know, like myself, don't even know they're hypermobile. So once I got myself healed, I said, I think I want to start teaching people how to walk the way I'm walking now. And it all just grew out of that. It was a blessing I hate to say it, but it was a blessing to hurt my knees and have 3 knee surgeries. And over 20 years later, I am pain-free and fully active. Truth is, I get injured because I'm too mobile. So I get injured, but now I know how to heal. And I also have an awareness of what my injury is, so that I can be patient about how long it might take to heal.
Wow. But hold on. So when you say injury, are they because you're doing yoga, or is it doing another sport? What really causes you to get injured?
Great question. I can literally step wrong off of the curb, and because my ankles are so loose, just trip and sprain my ankle.
Oh, wow.
A while back, I wanted to start weightlifting because I really believe in weightlifting, but I have always had trouble with weightlifting because I would get injured. And I started weightlifting again and immediately injured my elbow. And this time I was really intent on figuring it out. And a few months later, I have figured it out. So I'm still lifting, and I'm not lifting a lot, but I'm still lifting, and I'm no longer injured. So for me, it's, about 2 years ago, I developed tennis elbow that I think was from cooking the way I cooked. Took me a long time to heal from that, but healed it. So anyone who is hypermobile, just the looseness of the joints makes injury so easy to happen. But once you know how to take care of yourself, like one of the reasons I get injured is because I'm really active. And that's what I want to be. That was one of the things that scared me so much going through the knee surgeries. I really thought, oh my God, I'm never going to do yoga again, let alone, play with my kids, right? It was just this incredible process of fear that I was never going to be able to move. And here I am, I move a lot, and I accept the fact that because of my hypermobility, I might get injured. I don't really concern myself with it. I just know that when I do get injured, I'll be able to heal.
So is it like the ACL, the meniscus? Is it torn ligament? Is it like joints? What really do you tear?
So my three surgeries, the first one, it wasn't an actual. So yoga set me up for all of these things.
Okay.
I was playing softball,
Okay.
and your classic meniscus injury is plant and twist. So I
Correct.
was playing softball and playing third base. I turn, someone hits the ball down the foul line. So I turn to I get the ground ball. And when I came up to then twist
Oh,
to
yes.
throw it to first, my knee went, but my foot did not.
Oh,
So my
geez.
foot
Oh,
stayed planted, and I heard a pop. Like
yes.
there was kind of an explosion in my knee. And that surgery was the more intense one. That surgery, the entire meniscus had come off the bone. So for that surgery, the doctor had told me, yeah, 10 days you'll be back on your feet and walking around. But it turned out they had to sew the meniscus back on. They had to put it back on. And I was on crutches for 6 weeks. The rehab was way longer than expected. And then the second surgery was actually the other knee. The other knee popped from a different playing golf.
Okay.
And uh, but they only had to do a clean out for that one. And then the third one, back in yoga, I did something in a pose, felt another, you don't know if it's a tear or what it is exactly. So they had to go back in and clean out the first knee again.
Oh, I see. I see. And the third surgery was, you said you have three surgery, right?
Yeah, third was just a clean out of the first one.
Okay.
So
Okay.
like what they do very often, the meniscus frays and it'll like fray into pieces.
I see.
And you could be walking along fine, but one of those frayed pieces gets into the joint as you go to straighten the leg, and that can be excruciating. So a lot of meniscus surgeries, they just go in and they just clean up the kind of frayed pieces.
I
So I
see.
have two of those.
I see. I see. So, after the third surgery, you said that you had nothing for 20 years. So everything's been fine. The surgery was successful. So they didn't need, there was no scar tissue whatsoever.
So it's really interesting. Rollerblading is another thing I do. I really
Okay.
love to rollerblade. And everything I do is fine. I feel no after effects. When I do yoga, I don't feel my knees. When I bike daily. That's my big thing.
Okay.
Don't feel my knees. When I rollerblade, and I'll go for like somewhere between 6 and 10 miles. After I blade, my left knee will throb for about 10 minutes. And that is literally, I would say, the only manifestation of those surgeries. And when I first was blading again, I got really worried about that. But one of the things I'm telling my clients and people is you have to be able to take a step back and be objective about what you're feeling. So I let it rest, and then I bladed again, and I felt the throbbing, and I bladed again, and I realized it's something, whatever, there is something about blading that is bothering my knee a little bit, but not so much that it sticks around. It's never there it's never there even in an hour. But I am still fascinated that every time I rollerblade, that left knee is going to throb for about 10 minutes when I'm done.
Wow. Okay. I see. And so how are you teaching your clients to manage pain? Because if you're like a pain management expert, obviously every pain is very subjective. Everyone have had their own set of injuries. How can it be linear among everyone?
That's a great question. Um, well, it's interesting because the clients I tend to get are people that have been to multiple doctors who haven't helped, very often have taken medications that haven't helped. And when I was mentioning the sensitive people, a lot of people don't do well with medications. Medications that help everyone else, they don't help these people, right? So so the clients I get are people who are like, after trying everything, like I said, injections or even surgeries, 3 o'clock in the morning, they are just so confused. They're Googling around and they stumble upon me, and that's how we begin to work together. And my clients take all forms. So it's, like I said, sensitive people, hypermobile people, but I do a lot of work with trauma, and that's both like emotional trauma, but also physical from like car accidents and just across the gamut. But what's interesting, I teach everyone the same way. And the hallmarks of what I teach, there are three pretty specific hallmarks. Learn to stand correctly, because no one stands correctly. I keep waiting for someone to show up in my office and stand well, and no one does. Learn to walk correctly, because no one, one of my phrases, who taught you how to walk? Right? We start walking when we're pre-verbal. So, your parents might cheer, but you're on your own. Like, you just got to figure it out, and you learn by imitating. And
Yes.
what happens if one of your parents was in a car accident a couple of months before your birth and they're limping? That's how you're going to learn how to walk. You're going to take on that pattern. So walking is fascinating. No one taught you how to walk, so I'm going to teach you how to walk correctly. And then the third piece is relaxing the nervous system, because
Yoga, not yoga, but meditation, stuff like that.
no, actually, through what I call release exercises.
Okay.
But I am encouraging, I encourage everything. I encourage everyone to meditate. Meditation is a very special thing in our world, because it's one of the few things that can actually change the brain. We'd like to change the brain, but it's not easy. And one of the interesting things about a lot of medications, there's something in the brain called the blood-brain barrier. And a lot of medications now are learning to cross the blood-brain barrier. So I think in 10 years, there will be ways to change the brain. But now we know that meditation completely can change the brain. So I encourage everyone I work with to meditate, but I don't teach meditation.
Oh, yeah,
But
okay.
I don't know if you're familiar with the psoas muscle.
Yes.
Psoas muscle is my favorite muscle. And I think it's the muscle. So why I'm so interested in the psoas, it's the most important muscle in the body for three reasons. So it's the muscle of standing, because it's what holds us upright. Our lumbar curve, which we are the only creatures on earth that have a curve in their lumbar spine. And the lumbar curve is created by the psoas muscle when we come up to stand. And it's the muscle of walking, because every step you take that's successful is initiated by the psoas. But if you don't walk correctly, like I think most people don't, you're not using your psoas. So you're actually making your body work way more than it should. But then the esoteric / kind of woo-woo piece of the psoas is, I believe it is the muscle of pain and trauma. And what I mean by that, and this is definitely esoteric, when I'll use a car accident for instance, because the car accident is fast and furious, right? It just happens. The body has 2 or 3 seconds to process what happened to it. When something happens to the body and the brain that it can't handle in a given moment, I think that unprocessed energy actually goes into the psoas muscle and lives there. And it will live there until you are ready to let it go. So through exercises that I call psoas releases, that's how we encourage the body to let go of these emotions. But I always like to add the caveat that one of my anatomy teachers asked me, what's with this interest you have in the psoas? And I said, I really believe you can heal the emotional body through the physical body. by releasing the psoas.
Sure.
And she looked at me and she was like, no, that's really dumb. Muscles are muscles and they move the bones. That is their only function. And I said, okay, I really respected this person. I loved her as a teacher. I said, great. I can say anecdotally, like when I do a Psoas Release Party workshop, it's one of my workshops. Let's say there are 40 people in the room and I put them into the first Psoas release. I would say 30 of them lay there and nothing happens.
Mm-hmm.
But 10 of them, and it's all different, right? But 10 of them, weird things are going to start happening. Their legs might start flopping side to side. Their shoulders might start jerking. Their hands might start slapping. Like, it is such a bizarre thing to see. I'm very used to it 20 years later watching this happen. But to me, that's my anecdotal evidence that this is more than just a muscle, that it's holding on to our energy that we can't handle. So those are the three pillars: stand, walk, and figure out how to get. So what I refer to it as being stuck in the sympathetic nervous system,
Mm-hmm.
which is where a whole lot of, it is not easy to be in this world. It's traumatizing in any way. I used to say, go live on a farm because that's not so traumatizing. But you know what? That's traumatizing.
Yes, I have it. Yes.
So, and it's been an amazing ride to see just how simple it can be to change the way you stand and walk, though it takes repetition, and the benefits that you can get from it and what it does for the nervous system.
So when you talk about the psoas release, is it the same thing that fitness trainers recommend to do, the self-myofascial release, when you have like knots in certain areas of your body to be able to kind of like release the tension? Is it the same process that you would have with like an instrument or like a tool that trainers have, like either a tennis ball or a bar that has like ridges on it, so you could kind of like roll on it? Is it something like that, or is it something that just do the basic movement and then will release the psoas?
Um, no, that's another great question, and I would say it is the exact opposite of that.
Okay.
So, and this is where it gets back to sensitivity, right? So I work with a lot with the idea of the 80-20 principle, and 80% of the world can take one of those psoas devices and push that into their psoas and get relief, right? 80%. 80% of the people can get through the world without changing their posture. Like I like to say, some people can smoke and drink their whole life and they don't suffer for it. Not everyone, right? So that other 20%, when they go to use one of those devices and they go to put pressure on the psoas or they go to a doctor's, they can have the most adverse effects, especially when we're talking about trauma and physical trauma. It can trigger the worst effects. It can make whatever you're going through a lot worse. And that happens a lot. So what I'm teaching is passivity. One of the main things I teach is something called constructive rest position. And it's been out there. I certainly didn't invent it. A woman named Lulu Swigard did. Like the Alexander technique, which is another body work method. They love this position. And it is literally doing nothing. It's laying on your back, the knees bent, feet flat to the floor. You tie a belt around your thighs. You sit there for 15 minutes, 30 minutes. I literally have clients who are doing it for 3 hours a day.
Oh boy, this is like
Right?
dialysis.
Well, they're doing it while they're watching TV at night.
Okay.
So, but I turn them on to it and I say, look, you're going to start doing this 15 minutes every day. If you have trouble sleeping, you're going to do it 15 minutes before you go to sleep.
Okay.
If you have trouble waking up, you wake up in pain, you're going to do it 15 minutes when you wake up. But it's kind of crazy. People fall in love with this shape and they end up, okay, well, my husband's on the couch. I'm laying on the floor in constructive rest for a few hours while we watch a movie. So, and it's a wild, and there are other different releases, but they're all based around the same thing. They're all based around passively releasing the psoas. Because one of the things about the psoas, it's on 24/7.
Yes.
It's never shuts off. Like your pelvic floor never shuts off. The psoas, there are certain muscles that never shut off. So if you believe in what I'm saying about trauma living in a muscle, how is that trauma going to leave if that muscle never relaxes?
That's
So that's the idea of these poses, to get the psoas to relax and kind of invite it to let go of all this stuff it's been holding on to.
So you're more in the holistic approach. Obviously, you want to weed them off of any opioids or medication that deals with the pain, etc. Is it really the sole purpose of that, John? I mean, to have them to weed off medication, or do you kind of offer them alternatives, maybe going natural, maybe using naturopath, whatever it is? What is your approach, or what is your perspective to that?
My approach is that I want to complement anything they're doing and what they're working with.
Okay.
So I certainly don't, if I work with someone who's on anxiety medication, I am not going to tell them to stop taking their medication. That's just not what I do. I might say, if this work works for you over the next year or so, you might find that you can trail off maybe, right? But with the help of with a professional.
Okay.
I work with people so I take a very varied approach. I work with people, and this was yesterday, someone who has severe migraines
Okay.
and is on, if you're on migraine medications, they're really powerful.
Yeah.
And very often they're like injections. So this isn't something that really is a guarantee, but they actually sell this little clip that you put on your hand between your thumb and index finger.
Mhm.
And it's a classic acupressure point.
Okay.
And you can go on Amazon or anywhere else, and for $5 or $10, buy a little plastic thing that you put there. And there's no guarantee that it's going to work. But like with this client yesterday, I was like, I'm not telling you to get off the meds because that's not my role.
Okay.
But the next time you feel a migraine coming on and you're about to get ready to take your pill, try this for 3 to 5 minutes first
I see.
and see if it gives you any release. On a non-medical way, a lot of people who come to me wear orthotics in their shoes.
Oh, yes. Okay.
I really don't like orthotics.
Oh, okay.
But again, I don't say just stop wearing them. I say if all goes well, over the next year or so, you might be able to limit the use of orthotics or even get rid of them altogether.
Okay.
So one of my main